so the scene is safe. I've got the correct PPE, which is gloves and glasses. I'm just going to explain what I'm going to be doing to baby Jesse here, to the mother. So Taylor, I'm going to have to drill into his bone. So I'm going to use a driver, which is going to look a lot like a drill. I'm going to attach a needle to it, and I'm going to place it into his bone. It could be very confronting for you. I'm happy if you want to turn away. And it'll just allow me to give medications and fluids and things like that through. Are you okay?
Yes.
Wonderful. Okay, so the patient is laying down. I've gained consent. All of my equipment is right here, all set up and ready to go on a sterile pad. I've got a sharps container within reach. So the patient is lying supine. I'm going to identify the site that I want. So I'm going to do the proximal tibia. So I'm just going to hold the sides of the tibia like that, and then where I want to go is 1 centimetre below the patella. So now that I've identified the site, I'm just going to swab with an alcohol light, ensuring not to touch the site. There we go, I'm going to place that in a bin. Okay, so now what I'm going to do is I'm going to remove the needle from the packaging, and I am going to connect the needle to the driver set, ensuring that's sterile. Okay, and I'm going to remove the protective cover of the needle. Sharps out. Okay, so now everyone is warned, and I am going to place the needle over the site, ensuring not to touch it, holding either sides of the tibia, and I'm going to go in just until I touch the bone, ensuring that the 5 millimetre mark is visible. Okay, and so now I'm going to squeeze the trigger and apply gently until I hear that pop. Okay, and so I've done that with a downwards pressure, and now I'm going to remove the power driver by holding onto the tab. There we go. Needle is in there nice and secure. I'm going to remove the stylet just by twisting it anti-clockwise, placing that in the sharps bin. Okay, and so now what I'm going to do is I'm going to place a dressing over the top, just like so. And before I secure it, I just want to make sure that we are in the correct position. I'm going to attach my extension tube set onto the end. It's already primed with 10 ml of saline, and I'm just going to aspirate to ensure that there's no blood or bone marrow in there, even if there is. And then I'm just going to give the 10 ml of saline as a flush. Continue with that extension set already attached, and then I'm just going to take off these sides and make sure that it's all in place and write a date and time on there.